Acute wounds are among the most frequent reasons for emergency care and represent a clinical challenge that goes beyond the simple closure of a tissue disruption. Although many appear to be minor injuries, their complexity lies in the potential to affect deep structures such as tendons, nerves, vessels, or even body cavities. Furthermore, any wound represents a potential entry point for infection, making early and appropriate intervention a decisive factor in preserving anatomical function and reducing short and long-term complications. Expert wound management requires a thorough evaluation that considers the etiology of the trauma, the degree of contamination, tissue viability, and the associated functional or aesthetic risks. Irrigation cleansing, precise debridement, effective hemostasis, and correct wound edge approximation are the pillars of initial treatment. This is complemented by the proper selection of local anesthetics, the choice between sutures, tissue adhesives, or adhesive strips, as well as preventive measures such as antibiotic and tetanus prophylaxis. Every step must be performed according to rigorous scientific criteria, integrating safety, efficacy, and respect for tissue architecture. Treating a wound in the emergency setting is not just a technical procedure. It is an act of clinical precision that determines the patient's functional and aesthetic prognosis. Preventing infection in a contaminated wound, preserving hand mobility in an injured limb, or avoiding pathological scars in visible areas requires expert judgment and mastery of wound healing biology. A trained professional in this field transforms an immediate intervention into a lasting result, where science and skill combine to restore not only the skin, but also the patient's integrity and well-being.